Hey guys, my name is Carlo and I'm 13 years old.
I'm Gordon. I'm 40 years old. I'm married to Maria and I'm a car dealer agent.
Hi, my name is Maria. I'm 42 years old. I'm a newly hired realtor agent. We live in Toronto in a condominium.
Hello, my name is Joseph. I'm Maria's father. I am an Asian. I immigrated in Canada 50 years ago. My wife passed away last year because of stage 4 breast cancer. She was 75 years old when she died.
Hi, my name is Dr. Cha, and I am the OB-GYN of Maria to get pregnant. This couple is longing to have a second child, even though at this age it's discouraged to have a baby due to risk of abnormality. According to Han 2018, placental problems and birth complications, higher risk of a small or preterm baby.
The family has no issue financially and they love to go out and eat in restaurants and fast foods. Although Gordon is a Jewish and Maria is a Catholic, they are considered a happy extended family as they do not actually mind with their religion. Maria's culture has a strong family ties, especially with their parents. The family goes to the Catholic Church sometimes, where they see their other relatives like Maria's aunt and cousin who lives 20 minutes away from the Jacks family.
Oh, Father. I know that you're getting old every day, but how come you really need more assistance in performing your activities? You're more forgetful as well. And the sad part is you're physically and verbally aggressive. I think really needs to go to the doctor.
Eventually, Joseph was diagnosed with dementia, specifically Alzheimer's disease. When a family member is diagnosed with Alzheimer's disease or other dementia, the effect on your entire family can be overwhelming. Mayo Clinic 2020.
I'd rather eat than socialize with other people.
I hate math. I'm just gonna go to the cafeteria alone where no one is around me.
To eat.
Maria spends more time in taking care of her father as she deeply saddened with the dementia, without knowing their son Carlo is not doing well in school, especially the math subject, and not socializing to others.
Hey Gordon, work is finished. Let's go out and have some fun. Hey, alright, sounds good.
Despite Gordon is a good provider to his family, he is a heavy drinker and smoker. He started about 15 years ago. He usually goes out with a friend Romeo almost every after work, which negatively impacts the relationship with his son.
Maria and Gordon, I really advise you to avoid stress, drinking alcohol, and smoking, especially you, Gordon. However, you always failed whenever you tried to quit, and now you have a severe obstructive sleep apnea, according to Maria.
Yes, Dr. Cha. I feel very exhausted during the day. I can't sleep due to my husband's loud snores and because I assist my father at night to go to the washroom. Dr. Cha, I have lump in my right breast. It didn't bother me before, but now it's very painful.
Maria decided to go back to Dr. Cha, and unfortunately, it has been confirmed that she has a stage 2 breast cancer. When Gordon found out that Maria has a breast cancer and realized how overwhelmed she is with all the situations, including Carlos not doing well in school, low self esteem, he decided to lessen his alcohol intake, but unable to stop smoking. Gordon can still provide financially to his family. However, Maria has stopped working due to her illness. To summarize the health problems, it is identified that the following problems: the diagnosis of dementia of Maria's father, Joseph, the diagnosis of severe obstructive sleep apnea of Gordon, the diagnosis of stage 2 breast cancer of Maria, failure to quit smoking and drinking of Gordon, low self-esteem of Carlo, obesity in Carlo, mental stress of Maria. The health issues enter this family is mainly due to the lack of communication among the family members, as Maria was giving priority to take care of her father, Joseph, and Gordon affected by the unhealthy lifestyle or habits including alcoholism and smoking. Maria was not able to help/support Gordon while he was trying to quit the drinking and smoking. There is a lack of knowledge regarding the resources can be found in the community at first leads to the family missed their relationship among them, but gradually Joseph was referred to LHIN for a community support service. Gordon and Maria have asked the help of their family physician to address Gordon's sleep apnea, smoking, and overweight. This is a genogram of the Jack family. This is the ecomac of the Jack family. Therapeutic questions. Always make them your priority. Being polite and really listen to them. Do one extra chore without being asked and without expecting in return. Develop a positive attitude towards them. Be yourself. Patients may be sick, but they are not unintelligent. They can sense if you, the nurse, is not being himself or herself. Be honest. If the patient asks the question that you do not know, a good response would be to honestly tell the patient that you do not know, but will find out the correct answer for them. Be genuine, somewhat related to being oneself, as long as you are not overly sarcastic person. Show that you care. Make an eye contact while having a conversation. Follow through. Your next encounter with the patient, provide the answer or the item that they requested. Therapeutic questions you would ask and engage the family. Goals-oriented, opening questions, such as, what are your best hopes for our talk today? Solutions-oriented. What would you like to be different when you walk out from here today? Change-oriented. What is your main concern today? Problem-oriented. Evaluations-oriented opening questions, such as, what is been going well? Solution-oriented. What is different from today than the last time you were here? Change-oriented. What from last session impact you in this way? Change-oriented. Specific questions, such as, who is important to you in your life? Why are these particular people important? How do you think your family might describe you? What qualities or strengths might they say you have? How does your family handle disagreements? Is it okay to express your emotions in your family? To feel happy, sad, frustrated, angry? Were there any special activities that you did together? What difficulties or challenges may be facing in this situation? Psychosocial considerations are demographic information, social support system, impacts of illness on daily living and relationships, work, education history, skill and interests, strengths and coping strategies, self-care activities, meditation, exercise, prayer. Experience and comfort level with healthcare system. Goals, hopes, expectations. Fear, concerns. Previous and/or anticipated losses. Communication and information needs. Psychological issues and support needs. Difficulties, challenges may face in this situation are communication issues, individual health issues, death or physical injury to a family member, relocation, such as school changes, job loss, parental disorganization or dysfunctions. Commendations are observations of patterns of behavior that occur across time, are offered to every family in every therapeutic conversation, increase structural coupling between family members and the clinician. Maria, I just wanted to say how impressed I am with your dedication to take care of your father who has dementia. Taking care of a loved one who has Alzheimer's disease requires strengths and a lot of patience and understanding. I also really admire you of seeking help for your father. You contacted the LHIN to arrange a personal support to help out with your father's activity of daily living. Despite all of your close family ties that passed on your generation, many Asian descent wouldn't do that. I am so pleased that you did it without guilt. And I really need to say that you have a strong and beautiful personality, who never give up on things that you really like. Just like pursuing and planning to have a baby. However, with your current situation, you strongly decided to postpone this longing to have a baby. For you, Gordon, I would like to commend you of having a pleasant attitude towards your father-in-law. Despite of your culture differences, you remain supportive to your wife's wishes, goals, and most of all, what makes her happy, such as her father living with you. Furthermore, now you finally seek help for you to quit smoking. In fact, you've been successfully quitted your drinking habits. I'm sure you can make it this time with your smoking. Especially that you went to your doctor to help you with this. And also, I admire you being the head of the family because you never failed your wife and son, no matter what happens, as you remain responsible of providing your family's needs, particularly helping your father-in-law for his necessities needs, especially now your wife cannot work due to her current situation. These are the tools that we are going to use to support the family. These are the priorities for the family. Financial support, emotional and physical support, and social support. These are the interventions, and the family needs to change their lifestyle or need to have some changes, including Maria has to postpone their goal to have a baby and focus on her therapy. Both Maria and Gordon need to be able to spend quality time with their son and help him learn and develop the important milestones in his childhood. Referral will be follow up to the following.